you. Go ahead when you're ready.
Chairwoman Williams, members of the committee, my name is David Bagot. I'm the owner of Petersburg Pharmacy and president of the Illinois Pharmacists Association. I appear before you as a pharmacist who has witnessed firsthand the damage caused by unchecked PBM practices to patients and the sustainability of pharmacy across Illinois. In recent days, opponents of HB 1697 have presented arguments that deserve a clear rebuttal based on facts, public accountability, and patient impact. Claims have been made Illinois has passed more than 20 PBM-related laws since 2016, and costs have not dropped. Well, true reform requires transparency and enforceability. Previous measures lacked mechanisms for meaningful auditing, rebate disclosure, and anti-steering protections. This bill addresses these gaps directly and empowers state regulators to audit PBM operations. These tools are essential to realize actual savings at the pharmacy counter. They claim PBMs negotiate savings and lower costs for employers and patients. While PBMs do negotiate rebates and discounts, they frequently retain a large portion for profit rather than passing those savings to patients or plan sponsors. Illinois' own Auditor General confirmed this in 2023, finding that PBMs kept over $200 million in state Medicaid funds that should have reached pharmacies. Spread pricing allows PBMs to bill health plans significantly more than they reimburse pharmacies, pocketing the difference. HB 1697 ends this practice and ensures that negotiated savings go to the people who are paying for the benefit, the employers and patients. This is not theoretical. In 2021, Centene paid the state of Illinois $56.7 million to settle allegations that it overcharged the Medicaid program through PBM practices. In 2024 and 2025, CVS Caremark paid Illinois over $90 million combined for similar conduct tied to hidden pricing tactics in the state employee group insurance program. These settlements prove that PBM savings often come with a hidden cost to taxpayers, public employees, and patients. They claim HB 1697 will increase costs and reduce employer flexibility. This mirrors unfounded scare tactics we have seen in other states pursuing PBM reform. This bill does not dictate benefit design. Employers retain the right to choose plans. What the bill does prohibit is deceptive pricing, steering, and the retention of undisclosed rebates. The National Alliance of Healthcare Purchaser Coalitions, representing employers and purchasers nationwide, warns that the current PBM model has strong biases towards higher cost, higher rebate activities that drive up overall spending. Transparency will give employers more control, not less. They claim states are preempted from regulating PBMs under ERISA. This is just simply incorrect. In Rutledge versus PCMA back in 2020, the U.S. Supreme Court ruled 8-0 that states have the authority to regulate PBMs, even when they administer self-funded ERISA plans. The court was unequivocal. Reimbursement regulations and oversight of PBMs are permissible state actions. This bill follows that precedent precisely by targeting PBM pricing and conduct, not employer benefit design. They claim that this bill will restrict access to accredited and high-quality specialty pharmacies. As a pharmacist, I'm insulted by that. This bill does not ban specialty pharmacies or accreditation. It prohibits PBMs from misusing the specialty designation to block access or steer prescriptions for financial gain. Pharmacists in Illinois are fully capable of safely managing complex therapies, including oncology, HIV, and rare disease medications. What's at stake here is not quality, it's monopoly. HB 1697 ensures patients can access specialty drugs through qualified local providers not just PBM-owned mail-order outlets. They also claim Illinois-specific rules will raise costs for employers and workers here compared to other states. Many states already regulate PBMs differently, just as they do with insurance, provider networks, or scope of practice laws. Illinois workers deserve the same protection from opaque PBM practices as their peers in Arkansas, Louisiana, and Florida. Protecting Illinoisans from hidden cost is not a burden, it's a responsibility. They claim that patients prefer lower-cost pharmacies, even if it's not local. This argument just misses the point. The bill ensures patients can choose lower-cost options by requiring that they pay no more than the lowest available price, whether via insurance or cash. The bill protects patient choice by preventing financial penalties that force patients away from their preferred pharmacy. They claim mail-order services improve adherence and will be eliminated. The bill does not eliminate mail order or home delivery. It simply prohibits forced use of these channels through financial penalties or network restrictions. Patients who benefit from mail order can continue to use it, but those who prefer to consult with a trusted pharmacist or need same-day access will finally have that option protected. As the National Alliance of Healthcare Purchaser Coalitions affirms, patient-centered choice, not steering, is what drives long-term health outcomes. Here's the overriding fear-mongering tactic that is being used. This is going to raise costs. That argument is nonsense. In other states that have instituted meaningful PBM reforms, costs to employers and the state have dropped, not risen. Here's a solid example. In West Virginia, they carved the pharmacy benefit out of Medicaid managed care and returned it to fee-for-service. In the first year alone, they saved $54 million. Illinois has 8 times the number of people on Medicaid, so to compare apples to apples, in Illinois, that would represent a potential $432 million savings, and that's just in Medicaid alone. The truth is simple. PBMs are here to profit immensely off running the payment system for Illinois pharmaceutical care. Please see them for what they are and see where their true interests lie. Last year, Illinois lost over 85 pharmacies, many in medically underserved communities like the rural areas that I serve. These closures are the direct result of pricing games, exclusionary networks, and unsustainable reimbursement models perpetuated by PBMs. This bill is our opportunity to reverse that trajectory. This isn't a partisan issue. This is a patient access issue, a taxpayer accountability issue, and an employer fairness issue. In my pharmacy in Petersburg, I see patients every day who are caught in the middle of these PBM schemes. They deserve better. Illinois deserves better. We respectfully urge this committee and the House to stand with patients, pharmacists, and purchasers by advancing HB 1697. The people of Illinois should not have to pay for corporate opacity and profiteering. They deserve affordable prescriptions and the freedom to choose a pharmacy they trust. Thank you.